Root canals are dental procedures that are typically performed to treat an infected or damaged tooth. The process involves removing the infected pulp inside the tooth and sealing it to prevent further infection. In this video, we will explore the procedure for getting a root canal in detail. 1. What is a root canal? A root canal is a dental procedure that involves removing the infected or damaged pulp inside a tooth. The pulp is the soft tissue inside the tooth that contains nerves, blood vessels, and connective tissue. When the pulp becomes infected or damaged due to decay, trauma, or other factors, a root canal may be necessary to save the tooth. 2. When is a root canal necessary? A root canal is typically necessary when the pulp inside a tooth is infected or damaged beyond repair. Common signs that may indicate the need for a root canal include severe tooth pain, sensitivity to hot or cold temperatures, swelling or tenderness in the gums, and discoloration of the tooth. It is important to see a dentist promptly if you experience any of these symptoms to prevent further damage to the tooth. 3. What is the procedure for getting a root canal? The procedure for getting a root canal typically involves several steps and may require multiple visits to the dentist. Here is an overview of the process. First, the dentist will numb the area around the tooth with a local anesthetic to ensure you are comfortable during the procedure. Next, the dentist will drill a small hole in the tooth to access the infected pulp inside. The infected pulp is then removed using special tools, and the inside of the tooth is cleaned and shaped to prepare it for filling. Once the tooth is cleaned and shaped, the dentist will fill it with a rubber-like material called gutta-percha to seal the tooth and prevent further infection. Finally, the tooth is sealed with a temporary or permanent filling or crown to restore its shape and function. 4. What to expect after a root canal? After a root canal procedure, it is normal to experience some discomfort or sensitivity in the treated tooth. This can usually be managed with over-the-counter pain medications and should improve within a few days. It is important to follow your dentist's instructions for post-operative care, such as avoiding hard or sticky foods and practicing good oral hygiene. 5. Risks and complications of root canals. While root canals are generally safe and effective, there are some risks and complications associated with the procedure. These may include infection, nerve damage, and the possibility of the tooth becoming reinfected if not properly sealed. It is important to discuss any concerns with your dentist and follow their recommendations for postoperative care to minimize these risks. A root canal is a common dental procedure used to treat infected or damaged teeth. If you are experiencing symptoms that may indicate the need for a root canal, it is important to see a dentist promptly to prevent further damage to the tooth. By understanding the procedure for getting a root canal and following your dentist's recommendations for postoperative care, you can successfully restore the health and function of your tooth.